In the previous video, we covered sacroiliac joint or SI joint dysfunction and non-surgical treatment. In this video, we will cover additional anatomy and surgical treatment. If you've tried and failed all non-surgical treatments, it is important to make sure you don't have a spine problem that is causing referred pain down into the buttocks and mimicking SI joint pain. This can happen very easily because the nerves go through the spine, past the SI joint, and down into the leg. Also, we want to be certain the SI joint is the source of the pain. This means making sure you've had a CT-guided injection. You may have also gotten some X-ray guided injections subsequent to the CT-guided injection. These can further help verify that the SI joint is the right source of pain. If the injection into the SI joint gives at least temporary relief for the duration of the numbing medication, and your regular pain is gone even with activities that typically make it hurt, then the SI joint is likely the right source of pain. Once we're confident that the SI joint is the source of your pain and non-surgical treatments haven't worked, then surgery is the last option. Surgery involves locking the SI joint together and stimulating bone growth across the joint to fuse the sacrum to the ilium. This used to be a very large surgery to access the bones and put plates across the joint. Today, however, we can use minimally invasive techniques to place implants across the SI joint and bone graft into the joint to fuse the bones together. We use intraoperative 3D CT scan quality imaging combined with our 3D computer navigation to help guide us in the bone grafting, implant placement, and fusion of the SI joint. This allows us to be minimally invasive and extremely accurate in the surgery. After surgery, patients stay in the hospital 1 to 2 days, but will need to stay on crutches for about 6 weeks to keep the weight off of the SI joint while it heals. After that, if the x-rays look good, we let patients gradually go back to full activities. Fortunately, we found that over 90% of our patients have successful outcomes. Surgical treatment for the SI joint is a last resort, but a very successful one.